All right, Facebook family, welcome to this episode of the program, which is Saturday Online Clinic. My name is Regina Askia Williams. I'm a New York based family nurse practitioner, and as usual, it is a pleasure to spend our afternoon with you. Okay, so I have to start with an apology because despite the fact that we had reached out um, to Dr. Stella severally and gotten like confirmations. Uh, we are unable to reach her right now, but I would like to tell you, Dr. Stella, we are in the studio. The show has started, and if possible, please click on the guest link that we sent to you so that we can start this interview. Everybody, most Nigerians in diaspora, most Africans in the diaspora, we're here to hear from you. It's nice to, keep to your word. I know that you're a very busy doctor and the whole world is onto you right now, but there is nothing to fear when you're in the company of your family because we Africans consider each other as family. So I did send you a link. If you click on that link, you'll be able to come into the studio and join me because we have a lot of questions to ask and we would like to ask how we can support you. First of all, we have questions to help us understand why you choose to stand your ground as far as hydroxychloroquine is concerned. We also have questions on how you are updates you can give us on the research aspect on hydroxychloroquine. We have questions on the side effects of hydroxychloroquine, and we would also like to speak with you on how you're managing the patients that come to you, the patients that you put on hydroxychloroquine. Okay. In the absence of Dr. Stella, I know my viewers are really disappointed, but that's okay. That's what happens. But whatever happens, the show needs to go on. So we have a lot of talented African doctors. Okay. A lot of talented Nigerian doctors who are on hand to speak with us about this hydroxychloroquine situation. Dr. Nelson Aluya, welcome to Saturday Online Clinic. Please say hello to our audience.
Hello, audience. Good afternoon, good evening, or wherever you are. It's a pleasure to be here.
Thank you for stepping in and holding that down in the absence of Dr. Stella. I know everybody was waiting for Dr. Stella, including you. I'm sure you had questions for her, but I'd like to welcome you to the clinic. And then you have a practice, okay, where you also manage patients who have contracted COVID, right? And you have been a patient yourself. Please talk to us about that experience. Bear in mind that we're trying to explore why Dr. Stella seems to be standing her ground as far as using hydroxychloroquine is concerned. Tell us about your experience with COVID, first of all.
Well, first of all, it's a pleasure to be here. At any point in time where I'm called to come talk to our people when it comes to health and health related matters, that's my forte. That's what I do on a daily basis. That's what I breathe, eat, and sleep. So when you ask me to come as a, would I say, as a, not as a replacement, but to stand in so that our people will be better informed.
Yes.
Uh, I'm glad to take that honor. This is not in place of Dr. Stella or repudiation or confirmation of what she said or what she's done,
Mhm.
but just to help enlighten our people more so
Yes.
that they get to understand what it is that has become a big plague on our community. When I say our community, I mean, the Black community, not just here in the United States, but
Mhm.
all over the world. Even the ones in Belgium, from Brazil, to Haiti, everywhere else. So that's why I'm here. Yes, I do have a
Mhm.
practice. I'm currently at Newark Bethesda Medical Center in Newark, New Jersey. An assistant professor of medicine at the Rutgers University, Newark, New Jersey. That's at the New Jersey Medical School. Presently, the chairman of the New Jersey AMPA, which is the Association of Nigerian Physicians in the United States, as well as the national president of NAPAC, which is the Nigerian American Public Affairs Committee here in the United States as well. So, yes, I was a victim or as a patient of COVID-19,
Yes.
and I've also treated COVID-19 patients. And I'm
Oh,
sure
right. Yes.
somebody actually shared a picture or a video of what was showed this morning in AIT in Nigeria with regards to the information we did of, I think, sometime early this year when the COVID was just, coming out, ravishing everybody here in the United States. We pulled together some of the doctors from Nigeria, from, the UK and here in the US, where we did a little, public announcement telling us how to, carry out safe distancing, wash our hands, and all that, and in different languages. And I did speak in Pidgin English. So somebody showed me today, this morning, that it was being played in AIT Nigeria. So I was impressed and glad about that. That the story is still out there.
Hmm.
Yes, so it's imperative that we'll continue the discussion so that we'll be better informed,
Yes.
get a better understanding of what the disease is, how to
Hmm.
manage, how to care for it, as well as how to keep it under control. It's
Yes.
no doubt the disease of the century. It's that's caused a lot of debilitation, mortality, and morbidity um, globally,
Okay.
affecting every aspect of our lives.
Yes.
So
Okay,
um,
Dr. Nelson, Dr. Nelson Aluya. Okay. Now, the big thing right now is hydroxychloroquine. Have you
mm.
treated your patients with the chloroquine family?
well,
Honest, honest now. Everybody's bashing hydroxychloroquine, but you need to be honest. You must be honest.
well, I'll tell you this.
Yes.
I often say this, and I often do a lot of quotes. So some of you who know me, that I do a lot of quotes. And
Hmm.
I often say this, and I'll begin by saying this, that those who do not know their history is like a branch that does not know it's part of a tree. And what
Hmm.
happens to that branch? But
It
it
does.
grows but wither,
Hmm.
because it grows itself. And why am I saying this? Because first and foremost, you must understand the story of hydroxychloroquine and COVID.
Yes.
Um, if you don't understand why, then it's hard for you to understand why all of this talk and confusion and bashing and
Hmm.
political activism, negativism, and everything else that is concerning hydroxychloroquine.
Hmm.
Everybody know that. I mean, hydroxychloroquine been around with us for over 50 years. As a matter of fact, 60 something years, 60 years.
70, yes. Hmm.
Yeah, so and the whole issue of COVID and hydroxychloroquine, where if we remember SARS, the first COVID one, which I'll call it, came out. There are, like I said, 10 COVID strains that are available, but about three of them really do affect man, and they've caused epidemics and pandemic as we know it, MERS, SARS, and then COVID-2 or COVID-19. Now, the whole story of hydroxychloroquine actually started when a few doctors in 2005, that's why I'll come into my quote,
Yeah.
started the research on using hydroxychloroquine on the SARS COVID virus
Yes.
because they already knew that hydroxychloroquine has inhibitory effect on viruses. So
Hmm.
they tested it out on the SARS, which was the COVID one, initially 2005, and found that it actually does help inhibit prophylactically, and
Hmm.
even after treatment that was done initially with um, monkeys,
Yes.
and primates basically. So that's why the eventual study was done, and it shows it works in multiple ways. I've talked about this a couple of times
Hmm.
in some of the interviews I've granted, where one it increases the pH of the cell, and on the endomysial cells. And the
Yes.
mysial cells are just I'll call them, for on a layman term, they are tubes or tubules that connects the cell surface to down to through the cytoplasm, which is the body of the cell, into the nucleus, which is the active um, component of the virus, where the engine of the virus, almost like the brain and the heart combine
Yes.
together, where the cell is. So that tube that connects both is the endomysium. So it actually increases the pH of that cell. So at that point in time, when the virus gets in, it increases the pH. The pH disturbs the replication of the cell and
So the
inhibits
virus
it.
cannot replicate.
Right, that's one. Two, it also um, increases the influx
Yes.
of zinc, and that's why they talked about using zinc
Yes.
with hydroxychloroquine to help treat patients with COVID. So it inhibits the zinc, it increases the zinc intake of the viral cells, so that zinc in itself, under multiple layers, inhibits the replication of the virus.
All right,
You know,
doctor.
so
Okay.
that's another one. And then the third one, really, it's
Uh-huh.
actually at the receptor sites. Some of you have heard this technical term, the
Angiotensin.
angiotensin receptor 2.
Yes.
So at that level where the virus hit the surface of the cells, it
Mm-hmm.
actually inhibits that cell by changing, the component structure of that receptor, so that the virus cannot attach to that receptor. So in all three forms, that's how the hydroxychloroquine, works
All
on
right.
the virus.
Okay, so in different ways, in many ways, it stops progression of the virus. It stops
Correct.
replication. So the viral load is low. It stops the virus from getting into the cells and destroying them. So our immune systems are able to work better in the absence of a lower viral load. So in different ways, chloroquine, hydroxychloroquine, or the sisters of hydroxychloroquine work in different
Yes,
levels.
right. At those stages, at those levels, yes, it does
Okay.
work.
So let me ask.
That's what the studies have shown.
Let's do a little bit of comparing and contrasting. The HIV, the human immunodeficiency virus, okay, gets into our system, attacks our cells, replicates itself, and multiplies. The antivirals we use against it stop it from replicating, stop it from, synthesizing cell wall, and keep the viral load down. We end up saying that the treatment works because it keeps the viral load down and it encourages the immune system of the patient to stay healthy. But we never say it is a cure because there is no cure for HIV, right? Can we also, in the same vein, say that the treatment protocol of hydroxychloroquine works because it stops replication, it reduces viral load, and it keeps the patient healthy? But we cannot say that hydroxychloroquine is a cure for COVID-19. Would you accept that kind of submission?
Well, those are, in fact, if you want to use terms of considerations,
Yes.
you could say theoretically yes,
Yeah.
but without sounding too political and all that, there's
Mm-hmm.
a whole lot of connotations that come in and come out of that.
Mm-hmm.
On a theoretical basis, yes, that's how it works. Has it worked for some people? Yes, I would say, a lot of people have made claims that that's it worked for them. I mean, look, I've always said this: nothing is 100% in life.
Mm-hmm.
Some people say things work, and some people it doesn't. I mean, I'll give you often the analogy that I often say is this: eggs are good, and you eat eggs, and they give you nutrition. However, eggs are not good for everybody, because you can eat an egg and you'll be fine. I eat an egg and end up in the ICU. Does that mean eggs are bad? No, it's just that it's bad for me. So the question is, there's a whole lot of studies and people, in different parts of the world have come up and saying what they've done.
Mm-hmm.
Here in the United States, I think there's this gentleman, the doctor in New York. I met him personally
Mm-hmm.
2 years ago. He's done an amazing job upstate New York, where he claimed he treated a number of people with hydroxychloroquine, and then it worked. Yes. But what we're beginning to really understand now is that with hydroxychloroquine, if you use it early enough, and that's what the claim has been, that it does work. But once the disease it's set in and has stopped, got on to the point where the immune system has gone haywire and is on overdrive, at that point in time, yes, it may not really work at that point because hydroxychloroquine will not stop or inhibit the clotting, cascade that's been put into
Exactly.
process. It
Yes.
would not do that. I mean, we have patients who come in the hospital with infections, urosepsis, septicemia, and all that, and we start treatment. We start one, two antibiotics. Some of them work and they do well. They go home. We have other parameters. We measure inflammatory markers,
Mm-hmm.
ESR, CRP, D dimers, and all that, and lactic acid. But
Mm-hmm.
then you find out that just like with the with the COVID-19, once those infection has gone to a point where the cascade of inflammatory process has been put into place, it may not work,
Yeah.
and that's where you have conditions like a DIC, disseminated intravascular coagulation. At that
Yeah.
point in time, the whole system is clotting and declotting, bleeding and clotting at the same time.
Mm-hmm.
Those things does not work at that time. So
All
no
right.
matter no amount of antibiotics you use at that time, the mortality is really very high, 70% or more. So is
Yeah.
that the case that's with COVID-19? Yes, we're still learning, and most likely that's what it is. As the jury's out there, we're going to
Okay.
learn more.
All right. So let me ask you, now that you say that studies actually show that in the early stage of the disease, hydroxychloroquine would work, would you suggest that doctors, after analyzing or, after triaging or assessing their patients and making sure that there's no allergies that would, mitigate against their patients, would you suggest that we all be put on hydroxychloroquine prophylactically? Because if it works by reducing viral load and multiplication of the virus in our system, then we will not have enough virus to cough out and infect the other person. If we have a low viral load and we wear a mask, it looks like we would effectively be able to contain the spread and transmission of this virus. So my question is, would you advocate for us all to be put prophylactically on hydroxychloroquine as opposed to forcing everybody to take a vaccination they don't want to take?
Well, that's a loaded question, and I'll
Very
tell you this.
loaded because I'm
Yeah.
going to somewhere.
And I'll tell you this
Yeah.
categorically, no.
Okay.
Categorically, no, and I'll tell you why.
Why?
There's only one drug that you put somebody prophylaxis for a virus
Mm-hmm.
around, or maybe two. Only two viruses that you put people prophylactically on, and
Mm-hmm.
one is the HIV for those who've been exposed
Yeah.
to the HIV, either sexual contact or one way or the other that you put them on. We know individuals who are pregnant, those who've been exposed one way or the other, and that's for the virus, the HIV virus. The other one is for the what's the other one now? Where you use um, I'm having a brain block. Oh, it'll come to me.
Back to it. We'll come back to it. Yeah.
Yes, yes. The uh, the one that causes shingles. Jesus, my where
HCQ.
right, right. It's where you use either cyclovir or ganciclovir,
Mm-hmm.
for repeated cases of flare-ups. So
Yeah.
those are the only two viruses I know right now that you can. So why do I think you should not put everybody prophylaxis on it? Because
Yeah.
one, you and I know
Mm-hmm.
that this virus, you can have it and you can't tell you have it.
Yes.
So if you walk around, you're normal, you're healthy, no issues, no signs and symptoms. Why should I put you on any medication when I don't even know that you have it?
We'll
Now,
test it.
that's one.
Yeah. Yeah.
Two, if even if peradventure I check you and see that you have your the virus and you tested positive for the antigen,
Yeah.
how much virus do I know is in your body? In the HIV, we can count the amount of virus. We do the viral load. In this
Mhm.
case, we don't have capacity to do the viral load. You
Okay.
understand?
Yes.
So in HIV, we check the viral load, see what it is, also measure your CD4 count,
Mm-hmm.
and had initially, ab initio when the HIV virus pandemic started, we got to learn about it, and in between the jury was out there, should we start, shouldn't we start? But
Dr. Nelson,
eventually, we decided to put people on prophylaxis when they have a certain amount of viral load or CD4 count has dropped to a level. In this case, we don't know that. So should we put everybody? No, we shouldn't. You
President
know.
Trump is taking it for is taking a hydroxychloroquine prophylactically, and he said he is. And we hear, according to Dr. Stella, that so many others are taking hydroxychloroquine prophylactically. And then when we were children, we were put on hydroxychloroquine for Sunday malaria medicine. I don't know if you can remember that time way back in the day, but it had so many side effects, which we're going to discuss. But like you have said, there's so many parameters we don't understand yet. So putting somebody blindly on hydroxychloroquine prophylactically may not be a good idea. What about if they have if they're showing signs, if they're showing symptoms of infection? You would advise that they go onto hydroxychloroquine after seeing their doctor.
Well, again, at this point in time, it's a free
That's why
country.
you're
Anybody
beating
can.
around the bush.
Can you hear me? Look, it's a free country. Everybody can decide on what they want to do or how they want to do it. And again, it's still the prerogative of a doctor.
Okay.
If you feel, you're a doctor and you feel your patient is sick enough and you think, with signs and symptoms and confirmatory labs
Mm-hmm.
had shown that you have the COVID-19 and you think that's what would most likely work for you or work for the individual, and in the absence of nothing, well, I guess you can decide to do that, but you must discuss, the side effects, the gains, and the drawbacks of the medication with your patient first before you decide to do that.
Okay. So now, doctor, I worked on a COVID unit. Okay, when it was, when New York was the hot spot, we would cover up in PPE, go into the patient's room, and really hands-on take care of the patient. I can tell you that the cocktail we gave to the patients at that time, at the height of this pandemic, was hydroxychloroquine, that's Plaquenil, and zinc, and vitamin C, and we put them on oxygen therapy also, and we monitored their symptoms. We make sure that we always took like an EKG of the patient, like, to monitor the heart arrhythmias and monitor the side effects of this medication that we were putting them on. And doctor, we discharged many of these patients home, all right? Even though some of them were still positive on the second test um, of the when we tested them before we released them, we test the patients before we release them. Many of them were still positive, but their symptoms had subsided and they were able to breathe on their own. They didn't run temperatures. They were okay. And maybe you will explain to us later about the antibodies, why they were still testing positive and all that. But suddenly there was no Plaquenil on the floor. There was no
Yeah.
Plaquenil on the unit suddenly. We switched from Plaquenil, prednisone, zinc, vitamin to remdesivir and dexamethasone. Can you explain to us why the sudden switch? I know that we're going to talk about research in a little bit, but how come we used it and discharged patients home with it and they were doing well and suddenly it was withdrawn from the unit? Do you have any information on why that happened?
Well, in the heat of the pandemic, especially here in the Northeast,
Mhm,
California, Arizona, and Florida, they're going through their own heat now,
mhm,
which is unfortunate. But when we're going through it here in the Northeast, New York, New Jersey, Connecticut, Pennsylvania, as at that time around, we didn't have an answer to this virus,
mhm,
and everything and anyhow you think was something we could use, we used it. And at
mhm,
that point in time, and that's why again people remember the 2005 study and all the things that were done with hydroxychloroquine, which we used, we prescribed it. I did at that time as well.
mhm,
A lot of ID doctors did in a combination of stuff. Yes, did a lot of people get well? Yes, they did. But then
mhm.
again, like I said, when the whole immune system has been thrown into complete chaos, at that point in time, most likely it would not work.
Oh,
When the DIC stages had set in, obviously it would not work. And then, of course, we heard about the study that was done, the side effects and all that. But then again, there's a whole lot of issues that came up with the political connotations that came out with regards to, whether Gilead were doing study or whatever and all that and all that.
Mhm.
But the beauty of science is this: when we start something, we're trying to treat or take care of an infectious or disease process, we
Mhm.
tend to go on and research and learn a little more about it.
Mhm.
As we go forward, there will be mistakes, there will be gains and losses. So I guess maybe at this point in time, the loss of hydroxychloroquine with that research was what we lost. Who knows? Are we going to gain it eventually later? Most likely, hydroxychloroquine is being with us for forever. It will still continue to be with us. Who knows? Maybe we'll come back to it in a refined form, where we now, take out active ingredients in it that's protective, and remove the ingredients that may actually cause the prolonged QT interval, arrhythmia that people have said it causes. But in the absence of nothing, in most developing countries where there's nothing out there to treat individuals,
Yes.
rather than in the mercy of God. Look,
Mhm.
I think this is the time that Nigerians or Africans should come together and go in and research their own remedy,
Mhm.
rather than waiting for the Western world or
Mhm.
any part of the world to tell them what to do and just copy. I mean, enough is enough. Those of us here and all the other doctors, like you mentioned, amazing doctors, brilliant doctors anywhere, this is time for us to really go back home. I mean, we have Zoom now, we should have a conference, a national conference on issues like this, where great minds who work in the NIH, CDC, in the clinical field of research and all that, where
Mhm.
we have, this common dialogue with our people back home and say, look, what do we do for our people? Because look, the remdesivir that you talked about
Yes.
only comes in an IV form, and
Yes.
it's so expensive. It comes in an IV form. It's not in any form of tablets,
Mhm.
or powder or anything you can decide, or liquid. It's only coming in the IV, and it's only given to those who are severely sick, not just the regular places. And it's not a cure. What it actually does is reduce those who survived the hospital stay by 4 days. And what does that mean? Hospital days by 4 days. It reduces it. Well, again, that's where the semantics of the politics and finances are, come into play.
Mhm.
So this is the time that we should come together and say, look, what do we do for our people? How do we begin to remedy this? Do we look into things of the quinine or quinine,
Mhm.
family, or other things that are out there in our community back home in Nigeria or in the
Yes.
whole of Africa, where we can get answers to these questions?
Yes.
That plagues us, because our people are dying and we need to solve this issue. If
Yes.
the Western world is not solving it for us, we're smart enough, we're enlightened enough, and we're
Yes.
educated enough to know this, then this is the time for us to learn to, collaborate and pull our resources together. And
Mhm.
again, like I always say, resources, time, money, and intellectual capacity. And those are resources we must put together at this time, and
Yes.
not just wait for the West to tell us, because we cannot afford remdesivir. We
Yeah.
can't, and
Oh.
it's so restricted in this country
Mhm.
that it's government controlled. They're rationalized to different states,
Mhm.
rationalized to individual hospitals. So there's no way you can get it, as a matter of fact.
Yeah, so I know from what most of you have been sending to me, I know that hydroxychloroquine is in full use in Africa, and COVID centers in Nigeria are using hydroxychloroquine, treating and releasing the patients. But out here, we have to follow what science and the CDC say we must do. Our licenses and our practices are beholden to that. So we have to stay with that. I was going to ask you, Doctor.
Well, I'll tell you this, adding to what you just said. Look, CDC is CDC for the United States.
Okay.
We have our CDC, and we
Yes.
should have our CDC Africa. For
Yes.
God's sake,
We have it.
look, I know that, I know that, but the CDC for Nigeria should
Yes,
work for Nigeria, not copy what the CDC for United States is doing. Jesus,
exactly.
we have a group of people who are unique to us. We're Africans, we're black, we have our genetic components and all that. And those
Mhm.
are the things that we must begin to do,
Yes,
things that affect us. And I'll tell you this, let's look, let's call a spade.
yes,
And I've said it over and over, and it's truly disturbing to me on a lot of a lot of platforms, on a lot of stages. The reason why I'm saying that, when we talk about research, the research on drugs, even the remdesivir that was done, how many people were in that study
Many
that were
Africans.
black?
Yeah.
Where? They were black, not just Africans. They were black.
Mm-hmm.
How many? And if you look at all the medications that you and I swallow, for God's sakes, we constitute 1% or less in most of these studies.
Mm-hmm.
1% or less. So how the heck do I know that those medicines actually work for me
Mm-hmm.
when my type of people are not represented in
Mm-hmm.
those studies? And
Yes.
that's the reason why, barring the fact that we have all of these, bad indices that come out of study, for the health indices for study for Black people, we
Mm-hmm.
all fare worse all the time. We,
Yes.
we, we have the highest rate of death from heart attacks, from high blood pressure, number of people who die from complications of diabetes, complication of high blood pressure, and all that, because we're swallowing tablets that we do not form a rational, reasonable constitution in those studies. So how the heck do I know those medicines are good for me? Until we as a people begin to do our own study based on our DNA, based on our structure, based on our diet, food, natural, environment, will continue to die. I'm sorry.
Absolutely.
And that's why we must begin to do this. And we're talking about remdesivir. Again, how many of us were in that study that
Yeah.
were black, not just Africans? So how the heck will we know that those medicine will work for us?
Mm-hmm.
So look, when they did the whole work on the Genome Project.
Yeah.
This was started, I think, in the 1990s, 93, as a matter of fact. I think
Mm-hmm.
ended up in 2003, where they delineated the human genome, showing there were 300 trillion replications of the DNA sequence that make
Mm-hmm.
up the human being. But
Yeah.
guess what? Recently, we begin to understand that for the African subject,
Mm-hmm.
DNA that came out of Africa, look, over 100 million of them were omitted. Why? Nobody knows why. And life and humanity actually started from Africa.
Yeah.
So if you take away components of the DNA that constitute the beginning of humanity, then the Genome Project is not complete.
Yes.
Humanity in that case is not complete. So,
Yes.
but why was that done, as was reported? Because we're not at that table. We're not at that table when
And
those
we need
discussions
to
are being
be at
made.
that table. Yeah.
We need to be at that table. And,
Mm-hmm.
and this is the time, to call on those who know, to come on board. Look, I say this now and I say it again.
Mm-hmm.
This generation of Black people, Blacks, I'm not just saying Africans, I'm not saying Nigerians,
Mm-hmm.
Black people are the most educated. The generations of Black people right now walking on this earth were the
Mm-hmm.
most informed, enlightened, and most educated Blacks that have walked the surface of this earth any day, anytime, anywhere. So
Mm-hmm.
if you and I, and thank God for your platform, but if you and I are not doing it now, then who will do it? And if it's not now, then when would they begin to do it? So
Yeah.
we must begin to be on that table so we stop being on the menu. And,
Yeah.
and that's the way it has to be.
If you're not on the table, you're going to be on the menu. Okay. Brilliant, doctor. Brilliant. Thank you very much. And I want to challenge you, okay, that you and I should get together and put together a telehealth outlet where we can treat and counsel COVID patients. Okay. What do you say to that, Dr. Nelson?
Well, again, anything that uplifts our people and save lives, that's
Okay.
what I stand up for, and I'll be glad to do that.
All right, you heard it here first. Okay, so I'm going to take Dr. Nelson up on that, and you all can visit us at the telehealth clinic. Okay, all right, so let's talk about research. Dr. Nelson, there has been a huge backlash. As a matter of fact, Dr. Stella, who incidentally is a product of University of Calabar, where
Right.
she went to medical school in University of Calabar. I started out in University of Calabar Medical School. Okay, so I'm very proud of her courage and her boldness to stand by what she believes in. We really would have loved to talk to her today. But As far as the research goes, there has been a lot of outcry by many doctors around the world who have used hydroxychloroquine. Dr. Stella was not the first person to start, hydroxychloroquine with her patients, and she's still recording successes with hydroxychloroquine. It might have been her passionate delivery and maybe the exogenous circumstances of her faith, that people here don't really understand, that have put her in such a negative spotlight in the medical community. But I want to read a statement that, I got when I was researching into complaints made by doctors around the world.
Mm.
Editors of the Lancet and New England Journal of Medicine pharmaceutical state, they say that pharmaceutical companies are so financially powerful that they pressure us to accept papers that insist that hydroxychloroquine is toxic and poisonous to humans. And what do you say to that complaint by them? I know Big Pharma is out there having a say in whatever is being marketed to us in terms of medications for COVID, and nobody is able to fly in the face of Big Pharma and go scot-free. My issue is, where is the voice of the patient in all this? Should the patient not be an informed participant in their own care? Should somebody not be able to say, okay, I understand the risk, but as far as I'm concerned, for me, the benefits outweigh the risk. I'm ready to give it a shot. Why are we being pressured to wait? Some people are dying as they are waiting. Why are we being pressured to wait and receive alternative medications that we don't even know what is in? Like you said, Africans were not there when these medications were being manufactured. How do we know these medications are okay for us? Please talk to me about that, and also talk to me about mandatory vaccinations. What do you feel about it?
Right. So that that's a long rope of discourse that
Yeah, I hope you
you
don't
know
have
that,
yourself on.
we don't have the time, enough for it. But then
Okay.
again, first and foremost,
Mm-hmm.
I would blame the medical community. Why do I blame the medical community? Because look, we as doctors or physicians or healthcare providers,
Mm-hmm.
um, we gave up our rights. We gave up the mantle of leadership for the healthcare. And in all sincerity, we are the sole custodian of our health. I mean, and the health of the patients that we take care of. We're supposed to be the champions, they are champions, and fight for their health. And that's how it's always been until, politics crept into the healthcare system. You
Mm-hmm.
understand? And politics took in, and the need, not just the need, I'll use the word the greed
Mm-hmm.
for money took over the sensibility and care for humanity. And it's a shame, but that's exactly what happened. I mean, look at the healthcare industry in the US. It wasn't like this, where it is right now, because the doctors refused to look forward, and not just the doctors. When I say the doctors, I'm talking about the leadership in healthcare, right down to medical school, didn't take the chance to prepare young doctors for the future that's coming. I mean, everything has changed, including management in healthcare. Doctors are not at the helms of affairs anymore. They're not. They're not at the helms of affairs. They don't rule the hospitals or make final decisions, that has the empathy and sympathy for the patients that take care of. Now it's, the it's all about stock exchange credence and how much you're making and the shareholders cuts and everything else.
Mm-hmm.
So these are the beginning of the problems that took place. And right from the 80s, everybody saw it coming, and it is what it is. But until doctors begin to take, charge and take leadership of that space, it will only continue. And the same thing all through to healthcare. I mean, how many doctors are in research that are the helms of affairs in those industries, where you begin to pay attention to, the possible outcomes and weighing it to the livelihood and lives of individuals, and comparing those things together. So that's where we miss it, and it's here. But then, what are we going to do? I think we should go back to the drawing board, where we begin to teach individuals in medical school, the role and practices of healthcare delivery and leadership in healthcare. And I think the government of Nigeria, those who are in leadership right now in the country, seeing what has happened in the Western world, should go back and begin to teach these things.
Yes.
Some of us who are here should take that space, as a matter of fact. Go back and teach, what it is to be a healthcare, leader, and that place. Yes. So when it comes to research, a whole lot of things is out there.
Yeah.
From the vaccines, the whole call, the end box study, here the ones recently you saw the first individual who was being vaccinated for the COVID-19 virus that was set up. And I looked at the lady, it was actually a black lady, and I
Mhm.
said, "Oh my God, the aesthetics of this does not look good." A lot of people begin to think, "Oh, it has to be a black person first." But then again, do vaccines work? Yes. Do I believe in vaccines? Yes, I do. Because how many times you and I walking down the streets of New York or Texas or whatever, even in Nigeria now, um, for the major part, seeing anybody with polio, because it really did help polio. And
Mhm.
unfortunately, Nigeria is one of the third other countries in the world where you still have polio. Nigeria was taking off the record, I think 2018. We came back again, off and on again. But then, if you look at that study, there's a whole lot of political, innuendos in that as well.
Yes.
So, but we still remain one of the only three other countries in the world where polio still exists. So, yes, vaccines work. Yes, they do cure. But then in this case, let's see how it is. What the success rates for the vaccine is. Would it be 100%? No. As a matter of fact, we expect to be 50 to 70%. If it's 50 to 70%, yes, you can say it's an ideal vaccine, and that's what's classified as the ideal vaccine. Um, that would work. But then, what will be the drawback? We heard what the whole thing with regards to the influenza vaccine, where
Mhm.
some people reported that a lot of people have neurological complications of it. What are we going to get from this? Would it give neurological complaints
Mhm.
or complications or aftermaths? We don't know that yet. So, should you do this with precautions? Yes. Should you take it with care and see, what the fine prints or whatever it is, so
Mhm.
that individuals who have medical concerns do not take it? Yes. For instance, you and I know that the coronavirus affects one, the heart. So
Yeah.
if you already have a heart problem, should you be
Mhm.
taking the coronavirus vaccine? Well, then those are questions we need to ask. It affects the brain because it's against the virus. The people who had vivid dreams and and all that, and the huge risk of strokes in younger individuals. So if you have a neurological problem, should you take it? Then that's another question we need to ask, especially in our community. So these are things that needs to be addressed first
Mhm.
before I say anybody should go take on the vaccines.
Okay, thank you, doctor. Now, another way to get immunity, to build your immunity, is like through exposure. Somebody like you already have immunity because you are a survivor of the COVID infection. So now, if I come in contact with you, if I'm negative and I come in contact with you, um, I'm exposed to the virus. Would I be exposed to the virus through you? My question is, after you recover from the virus, do you still shed? Do you have the ability to infect somebody else? Would you be able to protect yourself against reinfection? Because there have been cases of reinfection of individuals who have actually passed after surviving a first infection of the COVID of the coronavirus. Please go ahead and talk to me about those things.
Well, I'll take it this way.
Mm-hmm.
Again, going back to the history of the disease, the MERS and the SARS. When they did studies then, remember these things have been around for, SARS, the MERS and the SARS. They came, in I think 2005, and so people did studies and showed that the MERS vaccine, no, the antibody actually will last about 3 years, and the SARS will last
Okay.
about 2 years. So
Okay.
what those studies had shown. As a matter of fact, when COVID-19 came up, and the earlier part of this year, in the heat of the whole thing, they went back, looked at those people, individuals again, and found out that after 15 years of people who were exposed to SARS, some of them still did have, the antibodies. Now, the
Mhm.
question again, are the antibodies protective? Well, the jury is still there, but we hope they are, because again, SARS and MERS, as we see, came and they basically were controlled. And I say this, unless this virus was designed in hell, it should behave like its cousins, the
Yeah,
MERS and the SARS.
maybe
So,
it was designed in hell, a hell of a.
right? Unless it was there, then that's a different story. But unless it was designed in hell, then it should behave like its cousins,
Yeah.
the SARS and the MERS. So, with respect, yes, you build antibodies. I got sick, and I have checked my if I have immunity. Yes, I do have immunity, and that gave me a little extra oomph for the things I do now. And I told people I've been COVIDized. So, and that's the term and that's the term I use, to tell people again, just to make them feel comfortable and allay their fears that
Mhm.
once you've had it, you survived. Yes, you will have antibody, but
Mhm.
the extent of the antibody is one thing we don't know yet. Where we're used to quantifying the antibody level. For instance, for the hepatitis B, there's a cutoff of 10. So if you have antibody for the hepatitis B surface IgG level 10 and above, we consider you as immune. But if it's less than 10, we consider you not immune. So we give you the 3 series again, and then check the level again and see if it's gone up to 10.
Mhm.
Some people will, but some people don't. So there are people who would never have those antibodies above 10. But the
Okay.
question is, are they immune? Most
Mhm.
likely they are, because on the standard studies of the research that was done, the cutoff was 10.
Mhm.
So again, do we have a standard cutoff level for this virus? None yet. We haven't. I'm sure that will come down the road if it continues to remain endemic with us. So, but for now, I would assume everybody who's gotten it is immune and should be protected. Now, the question that you asked me, I got the virus. Is it possible that I get exposed again to the virus? Yes, especially since I work in the hospital. Would I get sick again from the virus? Most likely not, but even if I do, it will not be as bad as I did. Again, studies that came out of South Korea and I think in Spain actually did show that those who have been sick from the virus, got well from the virus, if they get exposed again, yes, they can give the virus to somebody else who has never been exposed or who's not, well enough. But then this time around, I use the word, if you look at the virus, let's say it has 5 prongs, and that 5 prongs is what is required to get you to be sick. Now, if I already have had the virus and I
Mhm.
got immune, and the virus passes through me, by the time it's coming out for me to give it back to you, that
Mhm.
virus most likely will not have 5 prongs anymore. It may have 2 or 3. So it therefore means the virus will be weakened. You
Yes.
understand? So what I'm giving to you will be a weakened virus. So a
Okay.
weakened virus may make you sick, but maybe not as sick as a 5 prong virus will make you sick. You understand?
Yes.
So, and that's what, the whole context of one, uh, people live in a bubble. Two, people begin to talk about herd immunity.
Yeah.
You understand? And that's why most likely we hope that eventually people, will get the herd immunity and be covered. And as a matter of fact, in the wild, what I mean in the wild, out of control study, people outside most likely will get this virus, and that's how most people will get immune from the virus.
Okay. Okay. So if it's not too much of a private, exposure, what did you use to treat your own COVID?
Okay. Well, uh, pardon me to say this one. I used to joke and I say COVID is a bastard. The thing, it made me sick. Sicker than I ever thought, I would be, and and it gave me this generalized body aches and pain,
Mhm.
and then the fever that just kept on going, unabated. At that point in time, I really did take hydroxychloroquine because I had, kept it at home just in case. I'm a healthcare worker. I knew I was going to get exposed and get sick. I had the azithromycin as well. And then, but I didn't have the zinc because at that point in time, zinc is you get over the counter and I couldn't get it. So what I was doing, I was taking the zinc, the hydroxychloroquine, which was 200 milligram, twice a day. Um, and I meant it for 5 days, and then the azithromycin, and then I was taking multivitamins. Hopefully, hoping it would help.
Mm-hmm.
But in my experience, it did not. It really didn't. The fever would go down, and then come up again. It would go down, come up again. At one time, I was really very tired. I was like, God, what the heck is this fever? I'm tired of this fever. Enough is enough. So, but my personal experience, and I'll tell you this, and I'll be very frank with you. I had taken, giving hydroxychloroquine, but then at one time, hydroxychloroquine was out of the picture. You couldn't get it anywhere, and then there were rules about, oh, if you must get it, you must confirm that you have the COVID already
Mm-hmm.
before you get it. And that's, I mean, how many people were doing testing then? So what did I do for a lot of my patients who couldn't get it? I rather use mefloquine, because at this point in time, there are people who were home alone, sick,
Mm-hmm.
and dying, and
Yes.
I couldn't let some of my patients die without anything else. And look, a lot of my patients, when they took the mefloquine is actually the drug that we use to treat malaria as well. And
Yes.
that's the one you use to give malaria prophylaxis.
Mm-hmm.
Before we travel to Africa, to Nigeria, we take it once a week, once every week while you're there, 2 weeks after you come back. So, but the standard treatment for malaria it's actually 250 milligram, 4 tabs, once a day, one time dose. But in my experience, I took it one time and I knew it affects my eyes. So it gives you diplopia. So I
Mm-hmm.
usually don't give it that way anymore. I give it 2 tabs, wait 2 hours and give it 2 tabs. So in my experience, no side effect with the diplopia or visual disturbances that even the WHO and the CDC recommended. So
Yes.
again, you have to. Sometimes doctors should take their own medicine and see how it affects them, so that they learn and they never give those medicine the way the way they usually do. I learned, so I never did. So when in the heat of everything else, and there was no chloroquine anywhere, it was so scarce, I gave the
Mm-hmm.
mefloquine, and look, marvelous results. People got well and they got well quick. So when I took the chloroquine for like 3, 4 days and I wasn't getting well, and I sat on one night and like, dude, you've done this. And then I looked around and I had to ask, we had some mefloquine. So I took the mefloquine that day, 2 tabs, waited another 2 hours, 2 hours later, took the two tabs after I ate because it causes severe hypoglycemia, meaning it drops your sugar down so quickly. And
Yeah.
after that, the fever stopped till today. This was in April. Never had a fever since then.
Ah,
So and that's what I did. And I told some of my friends. I said, look, in the heat of all this, especially back home in Nigeria, and the COVID wasn't in Nigeria as it is now. And I
mm-hmm.
said, look, this is one thing we should begin to take a look at. If I have this experience, personally, the fever stopped immediately
Mm-hmm.
and I got well immediately, except for the fatigue that came on. This is one thing we need to research into.
Mm-hmm.
Maybe we should, do some randomized, double-blind study or however they say it,
Yeah.
on our people and see if it will work. But no zeal, no power, to do that. So we just left it like
Okay.
that.
Okay. All right. Thank you so very much, Doctor. Let me read out a few questions. Celestine Ogunyari says, please, my question for your guest is Dr. Stella Emmanuel right in all that she said that COVID-19 has a cure in hydroxychloroquine, zinc, and azithromycin, or is her submission a factual error or a medical misinformation? We did explain that. I don't know if it's okay to make a statement on her practice, but what we find is that in countries where there is no remdesivir and a lot of people have COVID, hydroxychloroquine might be the way to go, considering there's nothing else. Right, Dr. Nelson?
Well, from what he said, in all that she said, well,
Oh,
again, probably in all that she said,
mhm,
is it correct? No.
Mm-hmm.
Is it wrong? Like I said from the beginning, it's not a repudiation of what she said or what she hasn't said or validation of what she said.
Mm-hmm.
But the studies have been there. That was done on hydroxychloroquine way back in 2005.
Mm-hmm.
Published repeatedly, and another studies that came around. Does this thing, inhibit the COVID viral replication? Yes, it does. Has some people shown effects? Yes. New studies that come up to say, look, if it starts early, if you use it early, it helps. Yes. Um, but then again, for those studies that came up saying, for those in the hospital, were they just because they were solely sick? That's why it didn't work, probably. But then again, the jury's out there. But then, again, that's why I said that our people should take, crunching steps to do research for our own type and our unique, structure and type of humanity back home in Africa, so that we know what works for us and what can help us.
Okay. All right. There's another comment that says, are you guys for or against the vaccine and any cure? Are you guys in support of the use of chloroquine? We talked a lot about that, unless you want to say something else, Dr. Nelson.
Well, like I said again, vaccines, I believe in vaccines. They do help. Otherwise, here in the US, for those who live here, if I ask you if you've seen anybody who has, what do you call it, polio, you will tell me no, you haven't seen any of those. So that's because it works.
Mm-hmm.
For a lot of other things as well, vaccines do work. But then again, on this aspect of vaccines, for the COVID, when it comes out, yes, there are a whole lot of questions, like every other vaccine, where they tell you if you have this, don't take it. If you have that, don't take it. So these are the things that must be answered. It affects the brain. It causes strokes, the virus itself. So if you shoot somebody with a live or attenuated virus, we don't know which type is coming out.
Mm-hmm.
Would it have some of these effects? Well, that's things we need to know. It affects the heart. We know that. So if you have a heart disease, do we need to take the vaccines? Then,
Mm-hmm.
personally, I'll say no. But those are questions that need to be answered, like with every other vaccine, where
Yeah.
they'll have to put a clause to it that if you have this or that, don't take it. So until they do that, then I think you shouldn't. More studies needs to be done about that, and we need to come up with results.
All right. So, in closing, let's talk about COVID in Nigeria. What somebody was asking if the CDC, there's NCDC in Nigeria, Nigeria's version of CDC. Now, in closing, can you say a few words on how to manage the COVID pandemic in Nigeria from a clinical point of view? It looks like they're doing a good job, like using the hydroxychloroquine. But what else can you add to encourage them in caring for COVID, especially those people who have found themselves positive for COVID, but don't really know how to manage their situations at home? Please say
Well,
something to that.
right. I'll take it like this, and I may be a little more extensive with this because this is where saving lives really do matter.
Yeah.
And I'm passionate about that. It affects me deeply, and I
Mhm.
must say we must, save and protect and preserve life.
Mhm.
Now, understanding Africa as itself, we have the youngest population on earth, number 1 to 15
Mhm.
on that list are all in Africa. And then 1, 2, and subsequent to number 30,
Mhm.
we are still on that list. On that list, Nigeria is number 6, Niger is number 1, Democratic Republic of Congo is number 2, and Chad is number 3. They are right above us. So we have a very young population. Understanding that the virus, affects young people, but it doesn't do that much damage. Yes. So is that one of the reasons why we're doing well? True. Now, secondly, is the issue of the sun. And I always say, and I joke about this. Look, God did not put the sun there, especially in Africa, at that level for nothing. We all know now that for those of us who of the African extract, we make vitamin D from the sun, from our skin as we get exposed. And unlike what we were told when we were younger, and even when I was a young boy in secondary school, university, and all that, they're like, "Oh, come on, early morning sun. That's how you make your vitamin D." No, sorry, that is for those of the Caucasian extract. They have a lighter skin. They make their vitamin D in early morning sun. We don't. We need a higher amount of sun between midday and 2 p.m. I'm sorry, but that's how we make our sun because we need to make sun. Now, what does that mean? The vitamin D that we make from our sun is very protective. It is because it stabilizes. I'll use the word stabilizes your innate immunity that your body produces. And that's the reason why, with studies that have shown here in the United States and all over, even if you look at Belgium, the black population in Belgium is about 1%, but they constitute over 40 to 50% of those who had died from the coronavirus. So what's that? Again, it's still lack of vitamin D because of the temperate region where they're living. So, and most of the people here have shown that those who died from severe COVID disease had very low vitamin D levels. So my proposition now is, look, go get your vitamin D and take it. If you haven't, check your vitamin D level and see what it is. Otherwise, you take vitamin D. I have recommended for my family, and I do. If you take the 5,000 units, because I don't like taking medication, but that's my own personal thing. I rather exercise than anything else. So, but I take the vitamin D 5,000 units twice, 3 times a week, Monday, Wednesday, and Friday, just to boost my vitamin D level, so that that innate immunity that has been discussed with vitamin D is protective, because it actually protects you from the what do you call it? The complement surge that happens when you have the COVID, severe COVID. So that stage where your immune system go on overdrive or go crazy, it actually protects you from that, and that's what vitamin D really does, and it's shown that considerably. So everybody should go get your vitamin D and take it. And again, if you don't have vitamin D, then find time to stay in the sun. I know how people say, "Oh, I don't want to get darker." How much darker are you going to be? You're black already. What difference does it
What
make?
about
You
sunscreen?
know? Listen, sunscreen again. It's the exposure. I'm not saying you should go begin to bask in the sun from morning to night every day. No, just get
Hello.
a little time. Can you hear me?
Yes, yes.
Just get a little time when you get exposed at one time or the other. I mean, understanding that our people tend to work in the informal sector, you find out that most people are sellers, or and stuff like that. So they're up in the sun almost every day. So if you check, their vitamin D level is usually very high, and
Yeah,
that's why, again, most of us have really been very protected.
yeah.
And the second one, believe it or not, which is strange, is the BCG that we're given as kids. The BCG again, which is the vaccine for tuberculosis, has been shown to be protective as well.
Really?
Again, on yes, it's been shown to be protective on the innate immunity. Again, um, um, the same thing that the vitamin D does, because again, it stimulates your immune system and keep it on guard,
Yeah.
so that storage that they tend to have with the severe COVID doesn't happen. So there's a whole lot of things going on there. Again, maybe we'll talk about a lot of all this down the road as we come on.
Thank you so very much, Dr. Nelson. Thank you so very much. Now let's go through the COVID protocol in closing. Let's go through the COVID protocol: social distancing, face masking, hand washing, and anti hand sanitizer using. Please go ahead and talk to us about that. To
Yes.
remind people, and there's new additions. There's new additions. Avoid large crowds. Avoid, and when we're sending our children back to school, what are the things that we should be on the lookout for?
Right.
Please
Right.
talk to us.
Right. So I hope to have a separate discussion under the NAPA, that's the Nigerian American Public Affairs Committee,
Yes.
on returning back to school. I
Yes.
think it's a discussion that we must have,
Mhm.
especially in our community, how to protect ourselves
Yes.
and to keep our children safe. And not
Mhm.
just the children, but us ourselves. Because look, the kids will be fine. Thank God for that. But
Mhm.
it's the adults, the parents, the teachers, grandma and grandpa, when those kids go to school and come back and bring the COVID home.
Oh dear.
What does that mean for them?
Yeah.
So with the protocol, yes, the video is out there again. Like I said, somebody showed me that in Nigeria where we spoke in different languages, and I
Okay.
spoke in
Share
pidgin.
it. Yeah.
Social distancing 6 feet, apart.
Mm-hmm.
Wash your hands. Make sure you cover your face. The covering of your face, on your nose and mouth with a mask, is
Mm-hmm.
basically to protect your neighbor. So if I protect you, you protect me, we're totally protected. And that's just the way it is. Again, use the right mask. If you put your mask on and you blow through the mask and you can feel the air on the other side, it's not a real good mask. So you're not protecting somebody else. If you blow through and you cannot feel the air on the other side, it's protective. Why is that important? Because look, on the average, like they did with the COVID SARS 1, you require about 1,500. That's 1,500 dose of a virus for somebody to get infected. That's what they said.
Mm-hmm.
But again, most likely this is the same or even more. You may need less of that amount of virus to get infected.
Mm-hmm.
Now, if you and I are talking right now, and I bring out the virus, it's actually going at 25 miles an hour. So 25 miles an hour, I can infect the person who's sitting next to me, 6 feet apart. But then if I cough, that cough is going about 50 to 75 miles an hour cough. That's how much I spit out of the virus. Now, again, if I sneeze, that's about 200 miles per hour sneeze. And that's why they said avoid large crowds, avoid, bars and all that. Because if somebody sneezes and you're on the other side of the room, imagine something coming out at 200 miles per hour. You're going to get it.
Yeah.
So those are the principles behind some of the things that they talked about. So other than washing your hand, putting on a mask, avoid crowded places. Yes, I would also advise, please eat right, drink a lot of fluids, boost your immune system by getting out to get the sun, and
Mm-hmm.
taking your vitamin D as well, and rest well. But again, you must exercise.
All right. Thank you so very much. A few more questions before I let you go. Somebody asked how much vitamin D should children be taking, or the children need to take vitamin D. And another person asked, why was Dr. Stella not here when she promised? I guess she will have to answer that question because indeed she did promise to be here. And I hope Dr. Stella will, explain why. Somebody says she's confused about the sun connection to COVID. Um, Here in Texas, numbers have continued to rise in spite of the rising temperature. I don't think the temperature demobilizes the virus. I don't know, Dr. Nelson, tell us, but the sun, the heat, will encourage production of vitamin D if you go out there, like the doctor has said, to get your vitamin D in. And the last comment, well, they're just inviting their friends. Go ahead and make a few comments on those, doctor.
Well, through the heat, we talk about rising number of people in Texas, as there's whole lot of heat there. Yes, but the question is, with heat, people run away from the heat and run into the house, and especially black people who really need the sun. So you find out the heat is out there, but they're all indoors and they're not coming out in the sun. And those who really don't need that sun are the people who are out there. You see them in the beach basking and all that. But those of us who are black who really need it, we're not out there in the sun collecting the sun rays so that we can make our vitamin D. So if all our people can go out, get the vitamin D, so that they can get protected, it will do them really well. That's what I'll say with that.
Do children need vitamin D supplements, and how much?
Yes. As a matter of fact, it's so funny. I think about 3 years ago, the standard amount, because I'm also a pediatrician, the standard amount of vitamin D for kids was actually raised from 200 to about 400 need. That is in the food. Nevertheless, at this stage of COVID, well, for me, I always tell for adults, you could take two of the 5,000 3 times a week, and for the kids, personally, I recommend taking one tab of the 5,000 3 times a week, during this season. The reason why I said that is because, it boosts their immunity, it keeps them safe, and it helps their bones to grow. Again, understanding that kids can get infected. It doesn't do much to them, except we've had, the typical severe inflammatory disease that happens with kids, which is like the Kawasaki-like disease that happens in children. But
Mhm.
they're not that common; they're rare. And new studies that actually came up showed that kids age 10 and less do not emit the virus that much, but age 10 to 19 do emit the virus a lot. So those are the ones who you should be afraid of, and those are the ones that go to bar and all that.
We don't
So
when we say don't go out. Yeah.
yeah, but you cannot you can't keep your teenage children at home. They're the ones who will go out and do the things that they have to do. So, but then, the study again was done on those age groups,
Mhm.
10 and above, showing they affect more people, and 10 and less, less, need to spread the disease. So, but again, this is where we are. And I just, ask people to take your vitamin D, exercise, eat well, rest well, and take the standard protocol.
Thank you so very much, Doctor. We all appreciate you and your commitment to keeping us informed and educated on things like this. And the group you have put together, Nigerian Americans, NAPAC, and the
Yeah.
group you have put together to encourage us all, because you keep saying that power in power dispersed does not make an impact, but power concentrated is when we begin to make an impact. So I would encourage Nigerians in the diaspora, please, to join NAPAC and let's work together. Let's concentrate our efforts and bring development and good to us in the diaspora. Thank you very
Right.
much.
And a huge shout out to AMPA, which is the Association of Nigerian Physicians in the Americas, for their effort and what they've done, especially the New Jersey chapter where I'm the chairman.
Mhm.
We've actually gone to the airport to do COVID assessment and screening for individuals that are going back home to Nigeria. We've had 3 sessions so far. The fourth one is coming next Friday, the 7th of August, where
Mhm.
once again we'll be at the airport making sure that Nigerians who've been, stuck here all these months from the COVID are going home safe and sound and well as to keep our families, brothers and sisters, and fellow Nigerians back home safe and sound as well. So shout out
Thank
to
you.
AMPA.
Thank you, Ampac. Thank you, Doctor. And
Yeah.
thank you to all our viewers for spending your afternoon with us. I am hoping that you got all your questions answered. The doctor, thank you. I have to let you go because I know your patients are knocking on the door. I heard the doorbell. People are trying to contact you and everything. Thank you so much for coming to share knowledge with us. Thank
All right.
you. All
Thank
right.
you. It's a pleasure. Thank you and bless you all. You all be safe and be sound. Thank
Thank
you.
you. All right. Okay, everybody, there you have it. I'm hoping that you all had your questions answered. I know we are all very disappointed that Dr. Stella didn't show up as she promised she would. But then again, we don't know. Maybe there's an embargo. Maybe she's been instructed not to speak. We don't know. But hopefully, I will get an explanation, and whatever she tells me, I will share with you. But aren't you amazed at the body of knowledge that Dr. Nelson brought to the table today? I am, for sure. And what that leaves me with is that even though we all are bound by laws and regulations that governs this place, as far as Africa is concerned, as far as developing nations who do not have access to remdesivir is concerned or are concerned, maybe hydroxychloroquine will be a better alternative, or would be an alternative for them to use instead of having people drop like flies. Because like the doctor explained, it does work in the early stages of the disease, but it's definitely not a cure. All right. So thank you for spending your afternoon with me. And for right now, I have to say good night. God bless. Until next Saturday, take care of yourselves and of each other. Thank you very much. Bye bye. Okay. Oh my God. What a day.